I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
This is a show that Garrett, my producer, has been excited to do for a long time, and it's on nightmares and sleep issues. What causes nightmares, and what do you do about them if you have them? Now, I was joking off the air that the reason Garrett is excited about this is that he works with me, and that causes his nightmares, but it's not true because he won't leave. So
all it takes is one wrong job app, and
that's it.
that's
think,
what starts a nightmare.
You think it's a good job, and it's like, no! Same thing with dating. So they seemed okay when I first met them, but oh my God, what happened?
We need a dating with Dr. Joe segment.
A dating with I can do that. Well, we've done the Food Romance Connection, and we can actually do that. We can do a counseling session type thing on, questions to ask and how to deal with romantic issues, and sure.
We could probably bring Michelle in on that one.
We can bring Michelle in on that one, our life coach, exactly, and we can kind of maybe we do that one day. We'll do a little podcast on Dr. Joe's counseling.
If nothing else, we should do that like beginning of February next year and do like a training week.
Oh, maybe a theme for February, for Valentine's Day. We could have a theme, Food Romance Connection, and that's not a bad idea. Okay, we can do that. So anyway, hi folks, I'm Dr. Joe Esposito. That was Garrett, by the way, in case you're wondering who that was. And we're talking about nightmares. Now, nightmares are dreams that can be very upsetting, scary, strange. They happen when you're in what's called the rapid eye movement stage, the REM stage. I always wondered if the band REM was named after rapid eye movement. I don't know that. They're from Athens. Does anybody know that? Send us a message on Facebook or Instagram and let us know what REM stands for the band. I don't know. So what happens is you're in this rapid eye movement, that really deep sleep. And that's the stage when your brain is working the hardest, almost as hard as when you're awake. So nightmares are different from bad dreams. Nightmares always wake you up during the night, but you'll sleep through a bad dream. And it's normal to have nightmares from time to time. We've all woken up in a sweat. We've all, jerked on our sleep and said, oh my God, what was that? And I think my house is haunted because the fan in my house, in my bedroom, clicks on every now and then. And it happened, every couple of weeks. And I'd be sleeping, I'd feel the fan come on. So I got a new remote for it. And I thought, okay, I washed the remote one day. I put it in my washing machine and washed it. So I thought, okay, I probably just short-circuited something. I got a new remote, clicked on again. So I think maybe it's my father coming to visit me. I'd like to think that. And then one day my Roomba, my electric vacuum kicked on. Middle of the night, 2 o'clock, just kicked on. And I never get scared. It's interesting. Whatever it is, who's ever haunting my house, I'm like, okay, that's cool. And I'll just turn the fan off or shut the Roomba off. And so I'm just curious if that's a thing, because for me, that's not a nightmare. I don't wake up scared. I just go, oh, something's happening here. But if you're waking up, that becomes an issue. Now, dreams, including bad dreams and nightmares, still a mystery to us scientists. We're not quite sure what it means. Although we don't know what causes them, we know there are plenty of things that can make them more likely or make them worse. And we just talked about anxiety. Anxiety or stress is a biggie. Daily stresses in life can really bring on nightmares. So worrying about school, worrying about work, worrying about relationships, bigger events in life changes like moving or losing a loved one can cause nightmares. The number one cause of stress is quoting Dr. Hans Selye out of Canada. Dr. Hans Selye found that the number one cause of stress was death of a loved one. And I don't think anyone can really argue that one. Death of a loved one is the number one thing causes stress in our lives. The number two cause of stress is moving. Now, moving to a new job, moving to a new house, maybe moving to a new relationship, or maybe out of a relationship. So moving is the thing that Hans Selye found because he measured cortisol levels. And cortisol is a stress hormone that's released from your adrenal glands into your blood. And when we did our segment on anxiety, cortisol short-term is good. Cortisol long-term, dangerous. So if you're constantly under stress, the cortisol levels rise, and that can cause you to gain weight. It can cause brain fog. And so that can lead to things like nightmares. And so if you're having nightmares, I want you to think of it as a symptom. Something's wrong with my life, with my existence. What is it, and what can I do to fix it? And in most cases, it's one of three things. It's chemical, physical, or mental, or emotional. And so what we try to do in our office is we try to stabilize the body the best we can. Chiropractic care, and getting the joints lined up. Sometimes medicine is involved, sometimes PRP is involved. Stabilize the physical, fix the digestive system. Acid reflux, heartburn, burping, gas, bloating, these are all signs that the body is not working properly. And many times there's things we can do to fix that. We can adjust the stomach, we can get diet straightened out, we can adjust the nerve supply to the digestive system. So we really get in there and do wonders in most cases with digestive issues. And then we got to look at the nutrition. If you're sucking down what we call the 7 deadly sins of nutrition, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, I know you're thinking, that's my whole diet, Dr. Joe. I only live on the 7 deadly sins. So alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, all of those are toxic chemicals for the body. And the more you put in, the more problems you have. And so if you have a bad diet, many times that can lead to nightmares. So you got to get nutrition in your body. And I am blown away when I see what people eat. When I'm in a grocery store and I just look at their carts and I think, my God, man, how are you going to survive? There's no nutrition in that. That whole cart, $300 worth of groceries. There's not 1 ounce of quality, high quality nutrition, I should say. I mean, you're alive, but you're not thriving. So I would say the minimum supplements you should take, the absolute minimum, Dr. Joe's Super Greens and Dr. Joe's Essential Source. They taste great. They're 2 powders. They're on the website, drjoe.com. I take a scoop of each, shake it up. I had coconut milk this morning. I put my 5 drops of vitamin D in there, and that's how I started my morning. Then I took the rest of my supplements. Then I had some fruit, came into the office. I mean, that's just how a day goes with me. And so I can't imagine why you wouldn't be doing that either. Why you wouldn't at least take high-quality supplements if you're not willing to do anything else. Super Greens and Essential Source, that's the starter kit. Then I add vitamin D, of course, for the immune system. Most of us are deficient in vitamin D. I take omega-3 fatty acids for brain function and anti-inflammatory reaction. I take vitamin B. I take digestive enzymes when I eat cooked foods. I take adrenal support, of course, because we all get stressed out. The adrenal glands burn out, probiotics, glutathione. So we will customize a plan for you. If you want to become a patient, we will customize a nutrition plan for you. We'd love to. And if you have health issues, neck pain, back pain, shoulder pain, swollen discs, degenerative arthritis, knee pain, you might want to come see us. And let's see what we can do to try to get you well. Maybe it's chiropractic. Maybe it's medicine. Maybe it's PRP, platelet-rich plasma, where we inject your own cells back into the joint to try to stimulate new growth. Maybe it's supplements. So in our wellness centers, again, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can try to put together a wellness plan for you, not just chiropractic, not just medicine, not just nutrition. We cover all of that. So if you want to make an appointment, go to our website, drjoe.com. We'd love to be your doctor. And you can book it right online. The first visit normally is $375. We've reduced that to $249. That includes an exam, x-rays, consultation, first adjustment, going over the x-rays on your follow-up visit, and a nutritional evaluation. I can't imagine a better investment than you investing in your health. And it's relatively inexpensive. What you're getting is worth way, way more than that. And hopefully it's going to give you a path to go on to get well and stay well. So you can book an appointment right online. We accept most insurances, car accidents, sports injuries, Medicare. If you've ever been in a car accident, say it with me. If the car was damaged, you were damaged. In my experience, no one has ever walked away from a car accident unscathed if the car was damaged. So go to the website, do it right now because you're going to forget, oh, I got to do it later. If you can't do it now, write it down, get it done quickly. My doctors fill up very quickly for appointments. And I don't want you to be disappointed and say, I want to go see Dr. Joe's doctors, but I couldn't get an appointment until X amount of time. So just do it, drjoe.com. All right, so we're talking today about what causes nightmares. How about trauma? Post-traumatic stress disorder. It could be if you've been abused, if you've been beaten, if you've had a traumatic injury, if you've been in an accident. These post-traumatic stress disorders can come back and haunt you. And of course, I've spoken to people who have been in war. I've never been to war, so I cannot speak from a first person. But apparently the trauma has been intense for some of these folks in a post-traumatic stress disorder. And so when we see that, whether it's from a domestic issue or a family issue or wartime, we try to get the body as healthy as possible so that the body's able to heal from these traumatic issues. I can't make what happened go away. We can make the body healthy enough so that it works better. And that's what we try to do with all our patients, and myself included. I'm a patient too. Garrett's a patient. We're all patients. All my staff members are patients, so we try to give you the experience that we would want to have if we went to a doctor. I had a patient call me the other day. She saw a medical director, and she said, I've never been treated so well. Thank you so much. And I get comments on Dr. Amy, Dr. Kat, Dr. Pam, Dr. Irwin, myself, Dr. Martini. I get compliments all the time saying, I've never been treated like this by a doctor. Thank you so much for restoring my faith in healthcare. We try to do that. Mental health issues can also lead to nightmares. We're talking about nightmares today. Bipolar, depression, general anxiety, which we just talked about, schizophrenia. If you have these, you're more likely to have nightmares. Now, when you come to us with these issues, we always want to fix the digestive issue, the digestive system. The digestive system is linked to every emotional condition I've ever seen in my 40 years now of seeing patients. 37 years in practice, then I had my schooling, of course, too. So I've seen a lot of people with emotional disorders. I've known a lot of people with emotional disorders. Always, there's a digestive component that's never been addressed. And so many times people have reactions to medications. And the medication didn't cause the reaction. The medication affected the digestive system, which affected absorption of nutrients and production of something called neurotransmitters, which are the chemicals that make your brain work. And that's how we have an emotional or mental issue based on food or drugs, because it's affecting the digestive system. So the number one reason we see patients, by far, is pain. Neck pain, back pain, shoulder pain, numbness, tingling, car accidents. We're really good at dealing with those because we have chiropractic, we have medical, we have nutritional, we can refer out if we have to, orthopedists, neurologists. So we're really good at dealing with back pains. And chiropractic in most cases is the answer. But when it comes to emotional disorders, the number two reason we see patients is digestive problems. Acid reflux, heartburn, burping, gas, bloating, irritable bowel syndrome, cramping. And when we get the nutrition right, we get the nervous system right, and we work directly on the digestive system, physically adjusting and sometimes moving the organs around, crazy good. I had a patient, she hadn't gone to the bathroom in 2 or 3 weeks, which is just crazy to me. I can't imagine that. And we adjusted something called her ileocecal valve, which is a valve in her small intestine, between her small and large intestine. We adjusted that, and almost instantly, the bowel started working again. So many times we have to get to the cause of the problem, and it's physical, not chemical. So we always have to start thinking, what's causing my problem, not just treating the symptoms. So mental health issues many times lead to nightmares, which we're talking about today. Now we have to say what's causing the mental health issues. I trace it back in many cases back to the digestive system. So if you have digestive issues, folks, chances are you're suffering needlessly, and you might want to come see us. Okay? Medications can cause nightmares, antidepressants, antimicrobials. Okay, you have an infection, that can cause it if you're taking that. Beta blockers, blood pressure medication, drugs for Parkinson's, drugs that help you stop smoking, stimulants. Like we might give stimulants for people with ADD. And so we give you these stimulants, and that can slow down the brain, interestingly enough. If we give you a stimulant as an adult, as a child, sometimes it calms you down. That same stimulant can have the reverse effect and stimulate an adult. So you're thinking to yourself, sometimes kids are on medications and we're giving them a stimulant. That's because it works differently in children than it does in adults. And that's something we have to look at too, that drugs react differently in children and adults. And the drug companies know this. They do the research for it. So if you're on stimulants, that can cause problems too. If you think your meds are causing nightmares, try to get to the cause of why you're taking the meds and maybe get off the meds. Patients come to us all the time and they say, Dr. Joe, Pam, Irwin, whatever, Kat, Amy, I want to stop taking my medication. We always say the same thing. Don't stop your medication until you're well enough to get off the medication. Our job is not take you off the medication. Our job is get you well enough so you can go back to your primary doctor and say, hey, look at my blood pressure. It's doing awesome. Can I come off the medication? Any doctor worth his salt says, yeah, you're getting better. Let's see if we can modify it, reduce it, or eliminate it. And so we work with some really good doctors who would do that for you. Okay? Substance abuse or withdrawal can also lead to nightmares. If you misuse drugs or alcohol, you might find you have more nightmares. Withdrawal from alcohol and drugs, it can make it more likely. So when you start going through your DTs or your withdrawals, that can cause problems. Opioid drugs affect parts of your brain that regulate sleep. You might have a heavy sleep, but you can also go back and forth between stages of sleep much quicker. They can bring on nightmares, the opioids. When you go through withdrawal and your patterns adjust again, your nightmares go away. So that's why some medications, you just can't stop taking them. Again, people come to us and say, I want to stop taking my meds. I'm like, I don't think that's a good idea. We maybe can wean you off the meds. Your doctor, your primary can, and I can help. But you may not want to stop the drugs cold turkey because that can cause some real serious adverse rebound effect. It happens with some medications, even with headaches. You can have a rebound headache. You take the medication, headache goes away, medication wears off, you get a worse headache on the other side. So other things that can cause nightmares is the quality of your sleep. Now, we've done shows on sleep. If you go to our website, drjoe.com, and type in what you're looking for in the search bar, chances are we've done shows on it, we've done articles on it, we've done podcasts on it, and you can listen and learn, and watch and learn. A lot of them are videos. Watch and learn about your specific health issue and what I would recommend you do. And many times, I have patients come in literally, and I said not every day, every hours, several times an hour, and say, I watch your podcasts, I listen to your shows, and you've changed my life. It's really cool. We had somebody in the other day, and she's a writer for a major newspaper, and she said the same thing too. She goes, first I heard you, I thought, this guy talks too fast. But she says, the more I listened, the more I said, oh my gosh, this is information that no one else in the world is giving. And we do it every week. So she said, you changed my life, and I'm just honored to be here with you, and how can I help? So it's exciting when we deliver this message about healthcare and people do it and take it to heart. And the nice part about these shows is most of the stuff I teach you can do yourself. You can't give yourself chiropractic adjustments. You can't give yourself injections or medication or supplements, but I can help you with those things. But most of the things we give you are lifestyle changes. And all you have to do is change your lifestyle and you're in. So if you're not getting enough sleep, go to the website, drjoe.com, type in sleep. I'm pretty sure I did a show on it. And you can learn a lot from the website. And if you have questions, you can send them to me through the website as well. And we try to get back to you as quickly as possible. All of us, Joe, Garrett, myself, have the messages come into our phones. So whoever gets it, if they're available and they know how to answer it, will answer you right away. If we don't answer you right away, we're going to get to you, I promise. Maybe we're sleeping. Maybe we're having dinner. And I'm amazed how many questions come in at 2 o'clock in the morning, 3 o'clock in the morning. And I'm fascinated that people are on the website at those hours, and then I think they should listen to my show on sleep. And that's usually what I tell them to do too. If you eat right before you go to bed, that can speed up your metabolism, which can cause your brain to be more active. If you find you're having more nightmares, try to avoid after-dinner indulgences like coffees, chocolates, desserts. Try to avoid those foods. And I really want you to give yourself a few hours before you go to bed. So if you have dinner at 5 and go to bed at 10, that's probably okay. But don't have dinner at 5 and say, oh, I'm hungry at 9, I want to have a snack. No, that negates the whole purpose of giving yourself time to digest your food before you lay down. Because when you lay down, you lose something called gravity. Gravity pulls your stomach and pulls the food down into your small intestine. If you eat and then lay down, the stomach can push up against the diaphragm and food can reflux up into your throat. And too much reflux into your throat can cause chronic cough, chronic sinus problems, hoarse voice. You wake up, that could be acid coming up into your throat in the morning. So you really want to get to the cause of these problems, and one of the easiest things you can do is don't lay down on a full stomach. I mean, that's something you can do. I can't do that for you. You just have to learn. And then you'll learn too, if I don't have a snack at 9 o'clock, I sleep better. Well, don't have a snack at 9 o'clock then. I mean, some of this stuff is so logical. And patients come to me and I tell them, they go, doc, that makes sense. I never thought of it like that before. That's brilliant. I don't know if it's brilliant. It's just logical. And I've definitely got a logical mind. I think logically. So if you have sleep apnea, it could be the same thing. It could be that the stomach is pushed up against the diaphragm. Your diaphragm can't drop down and allow air into your lungs, so you're gasping for air. And when we adjust the stomach, pull it away from the diaphragm, check the nerve supply from the spine to that area, in many cases, it physically solves the problem. And then we got to beat you up and say, hey, stop eating late at night and stop eating stimulants like coffees, teas, and chocolates late at night. And so we kind of coach you through these things. And, I've been in practice a long time, and I'll run into people. I remember not long ago, I was at a car wash, and the guy working there, he looked at me, he says, you look familiar. He says, where do I know you from? He said, what's your name? I said, Joe Esposito. He says, you're Dr. Joe. I said, yeah. He goes, you came to my high school, Marietta High School, years ago. And I remember you talked about diet sodas and aspartame and how that can cause headaches. He says, I stopped diet sodas that day, and to this day, I've not had a headache. And up to that point, in high school, he said, I've been to all these different doctors, all these different therapies, all these different drugs. Nothing got rid of his headaches. And I don't remember who he was, obviously. He remembered me. And he just said, all my life, I wanted to meet you so I could thank you for changing my life with one simple sentence. Don't do diet sodas. Artificial aspartame specifically I was talking about. So a lot of the things we talk about are going to change your life. And if you want more consulting, if you want to come see us, again, we'd love to see you. Offices in Marietta, Duluth, Stockbridge, and West Cobb. Just go to the website, drjoe.com, book an appointment, listen to the podcasts. If you're a podcast junkie, whatever podcast service you use, type in Dr. Joe for the health of it. That's the name of our podcast, Dr. Joe for the health of it. And we post podcasts every single week. The website has over 1,500 hours of audio and video podcasts. It's drjoe.com. You can listen to them there. If you have questions, send them to me through the website. If you want to make an appointment, do it through the website. I'm trying to make healthcare as easy and simple and inexpensive as possible for you. But the only thing I can do is you got to make the step. You got to come see us. So we're talking today about nightmares. And of course, if you watch a scary movie or read scary books, video games, that can be an issue. But a couple of things you want to do. Nightmares happen sometimes, but try to stick to a sleep schedule and try to get enough rest at night. Again, if you're having sleep issues, go to the website, listen to the show we did on sleep, drjoe.com. Cut out your alcohol, caffeine, and cigarettes, especially in the afternoon and evening. I want you to cut them out altogether because there's nothing good that comes out of alcohol, caffeine, and cigarettes from a health standpoint. You might feel good, but we've done shows on alcohol. We've done shows on coffee. drjoe.com. Type in that word. You'll listen to the whole show. It'll change your life. If you work out late in the day, I used to play hockey in my 30s. And sometimes the games didn't start like 8, 9 o'clock at night. So I'd go play hockey, roller hockey, and I'd play and play, sometimes one game, sometimes more than that. And then I'd come home midnight, 10, 11, 12 o'clock, 1 o'clock sometimes. I would just be sweating. So I'd have to take a cold shower and just to try to bring my body temperature down. But I couldn't sleep. And I finally realized I can't work out at night. I don't do well working out at night. You might. But I do better doing my earlier in the day activities. So that's something you might want to consider because I couldn't sleep. And of course, that can cause my brain to race and that could lead to nightmares. So try to relax before you fall asleep. If you don't know how to meditate, you can go online and learn. I studied Transcendental Meditation back in college, and I still use it every day of my life. I still repeat what's called my mantra. And back then it was woo-woo and it was airy-fairy, and it was something you didn't want to do. You were embarrassed. It was hippie stuff. Now they're teaching meditation in medical school, chiropractic school, so it's really good stuff. And of course, stay clear of frightening movies and scary movies and things like that because don't watch them at night if they keep you up. So if you're having disrupted sleep, if it happens more than once a week, these nightmares, if it starts to affect your mood or your activities, if it makes you harder to do your daily tasks, if they begin the same time that you started taking new medication, you might want to talk to us. And let's see why you're having these nightmares, why you're having these sleep issues, and what can we do to get it fixed. We said earlier, in most cases, fixing the digestive system solves so many mental and emotional disorders. It's crazy why this is not just taught everywhere mainstream. I don't understand it because we do it every day, and the results in most cases, not all, are incredible. Neck pain, back pain, shoulder pain, that can affect your sleep as well. Come see us. Offices in Marietta, Duluth, Stockbridge, and West Cobb. We're really good at getting people out of pain. I'm even board certified in chiropractic, orthopedics, and pain management, and double board certified in nutrition. So we've got a good background in fixing these things. And as far as nutrition goes, the body needs nutrition for the brain to work. So the minimum supplements I would recommend would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you're not out in the sun at least 20 minutes a day, 3-4 times a week, I'd recommend vitamin D, B-complex, digestive enzymes if you're eating cooked meals. And if you want more information, you can go to the website and look up whatever you want to look for, drjoe.com, and send us your questions through the website, drjoe.com. Follow us on social media at Dr. Joe Esposito. We want to help get you well and keep you well. I'm Dr. Joe Esposito, drjoe.com. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.